Now, why do some lasers lose power?
It's a very good technical question. Some lasers do. And before I answer this, I would say that in general there are two types of laser modules which are used to make diode lasers. One, most expensive, they focus laser beam at the exit of the connector of the diode module, and then when the fiber delivery fiber is attached to it, then automatically will be focused into it. The other type of lasers, so they use several laser modules which are fiber coupled. Each of them is fiber coupled inside a tiny module, and then manufacturer combines several fibers in one bundle and glue it in one connector, and then that connector is connected to the delivery fiber. And that step is very critical because every optical surface produce back reflection, then some laser power will be reflected back into that bundle and will start burning the glue or epoxy or whatever is used to keep all this bundle all together. And then deterioration starts, and then lifespan of that fiber bundle will be a few months, if not less. And after a few months you need to replace it, replace the laser. Not even laser bundle.
When will the fiber bundle begin to lose power?
For second type, first type of lasers like ours, even they are more expensive, but it's worth to invest money in them. So they practically do not lose power unless so you exceed lifetime of that, which is many thousands of hours. But second type of laser, bundle type of laser, will start losing power almost immediately, because as soon as you turn the laser on, back reflection hits back and start melting epoxy, and then first step, and then like avalanche type deterioration. Some laser bundles fall down in 1 month.
So it sounds like the spectralized diode laser does not lose power.
No. Some dentists send laser to me to just check calibration, and just recently I tested one laser which was made 4 years ago. It's still well calibrated. I said that it's probably was problem with trimming the fiber.
Okay. Now, what is the lifespan of the spectralized diode laser?
This mostly refers to the lifetime of laser chip, of laser module. Manufacturer guarantees of reliable laser module guarantees 5,000 hours of continuous work. Of course, nobody uses it continuously, only for the night. When a heavy users of lasers, they combine all together in one day about 2 hours of continuous work. With 250 days in a year, so it will be 500 hours. So totaling then 10 years, or it's with a heavy use, or at the average use, it will be at least 15 years.
Great. Now, why did you change the wavelength from 810 to 980?
Many dental studies showed that 980 nanometers, the radiation, laser radiation at 980 nanometers is absorbed much better in the tissue. It means that penetration of this radiation inside the tissue will be several times less, means that focusing, concentration of the power will be several times better than for 810. And it means that you need to put onto the tissue much less power to provide cutting. And this will produce more precise, less damaging to the tissue cutting, and much better comfort for the patient. I would say better comfort for the patient. Less pain, of course. And talking about power values, many procedures can be done at power less than 1 watt with 980. At the same time with 810, similar procedures could be done at 1.2 or even higher. Some patients have a threshold of 1 watt when they feel the pain. So it means that at 980 there will be no pain for a patient.
That's the one I would want. Now, why did you develop the comfort pulse mode?
Well, it was also some advancement in the dental studies, which showed then if short pulses are applied to the surface of the tissue, they provide very nice decontamination of the surface. Means that they just destroy bacteria on the surface without any damage to underlying tissues. So that's why we developed it. And one of the reasons was that we would like to make our laser universal, that even hygienists can use them for periodontal treatments. In this case, so you never exceed the power, discomfort power for the patient, but at the same time, so it will be very effective decontamination of the surface and coagulation and all other positive features which higher power laser provide. But all this can be done with gentle pulse mode at much lower power.